Hi, and welcome to the OrthoClaps podcast series. I'm Sakib Rahman, and today I am with Dr. Louis Zirkle, MD. He's a president and founder and chairman of Sign Fracture Care. And today we're going to be talking about modern fracture care in the developing world. Dr. Zirkle, it's an honor to have you on the show.
Thank you. It's an honor to be here.
Great.
Thank you.
So tell me, how did you initially get the idea to start Sign, and how did it take off? Going back to the early days.
Well, when I was drafted by the Army and sent to Vietnam, and I was a commanding officer of a K team, which meant I took care of the liaison between the helicopter detachment and our hospital. And we were told to send the Vietnamese to another hospital, and we picked them up at the battle. And so I thought, that's not right, because the other hospital wasn't good. So I asked and was given permission. So I got used. I was given permission to treat the Vietnamese in our hospital. And I was also very happy that people all along the evac chain sent me implants. So I then went back to Indonesia. I went to Indonesia and stayed there for a month every 3 years teaching orthopedics. I then went to visit one of the residents in Sulawesi, and there was a man lying there, and I asked, what is wrong with that man? And he said he's had a fracture of his femur, and he's had that for 3 years. His family's quit coming to see him, and he's very depressed. And I said, why? We talked about this in our lectures. And he said very simply, he doesn't have the money to pay for an implant. And I realized with a sinking feeling that I had wasted 3 years, because we need to supply the implants of whatever we're teaching. I was also in Bangladesh. I went from Indonesia to Vietnam to Bangladesh, and I didn't realize the bone was much harder in Bangladesh. And so I had a plane to catch, and we hung up a reamer, and it wouldn't go in, wouldn't come out. I was very frustrated. It finally worked out, and I went home very discouraged. And I can still see the scenery. I ride my bike back and forth to work. When I said, why don't we put a reamer tip at the end of the nail? And that's become our fin nail, and it's being used more and more. And I'm delighted with the results, and we follow these results very closely.
It's a good story. For the listeners who are not that familiar with Sign, can you just in a nutshell, and of course, there's a lot of information on your website, but in a nutshell, just tell us what the program does.
Well, we're a nonprofit, and our goal is to treat orthopedic fractures in children, adults, hips, and we give the implants. We donate the implants with the understanding that they'll report the cases, including sending at least 30% follow-up. And so it works for the patient, and it works for the surgeons, and we're all happy with it.
That's great. What would you say have been some of the successes? And then maybe you can also talk about maybe some of the failures and how Sign has kind of met those challenges.
Well, we respond. The patient is at the center of what we're trying to do, and so we can see on the squat and smile picture and other pictures that the surgeon sent a very happy person, a person who has really escaped uh, being in bed and possibly losing their life. So we respond to our successes with a smile because we can see the surgeon takes pride, and we therefore take pride in the way the patient is reacting. So the successes are related to the patient, and the successes are related to quantity. We've just finished doing our 400,000 patient, and these are people who have no say in their fracture care. And actually, the WHO has stated that families who lose the wage earner, as would happen if the fracture wasn't treated well, spiral into poverty for 3 generations. So we're helping the family and the patient. We're also helping the surgeon because surgeons take pride in their work. And they because they take pride in their work, they want to do the best for the patient, and we can supply the implants where they'll get really good results. And so that's basically the answer.
Got it. And it's worth noting for our listeners that road traffic accidents remain, at least according to the WHO, remain the leading cause of death for young people around the world. If you look at ages like
Yeah.
five to 30, people who are in their productive wage earning years of their life, and that's deaths. I mean, of course, when you think about the people who make it and then have a femur fracture, and you're in a resource poor environment that you can't afford the
Yeah.
implant, and you don't have the C-arm capability. I think that's where we've seen sign really be able to make a difference. What do you What do you think are going to be some of the challenges to providing modern intramedullary nailing treatment going forward in developing countries? And how does sign fit into that? How do you think other parts of the ortho community can help to address those challenges?
Okay. Well, the our motto is uh, donation of appropriate implants, which can be used in developing countries. So the education has to come first. And education is now a challenge because of COVID. We haven't been able to go to see the surgeons in person, but also because sign has grown so much, it's hard to go to see them all. So we have to develop ways to educate that aren't necessarily person to person. And some of these ways are the webinar and other digital means, virtual reality. And so we're working this out. The Journal of Orthopedic Trauma just came out and listed a lot of different ways that surgeons could be educated. And it's quite interesting because a lot of people are interested in the education aspects, and as we are. The donation uh, part is a constant struggle because the steel costs are going up, wages have to go up. So we're trying to do our best to continue this way, and we will continue this way. The we want to make sure that we're giving the appropriate implants. This changes. When we first started, electricity was a big problem because they had surges which would destroy all electrical equipment, and so therefore, uh, we developed the sign system can be used without a C-arm and without power drills. We use carpenter drills. This is changing over the years, and so we want to change with it. Um, we we also are looking for better ways to evaluate. We have a squat and smile picture, which helps in two ways. One is that the uh, patient can get a picture taken of himself or herself, and send it in. And we have studied and compared the x-rays to the squat and smile and found that the squat and smile is actually more accurate. So we're working for different ways for evaluation, better, and we're looking for better and better implants. We now have changed. Uh, we've added hip fractures, pediatric fractures, and we continue to look for the opportunities that arise. And our fin nail, which is putting a reamer tip at the end of the nail, is becoming more and more used and works very well. We continue to modify it. We continue to modify our hand reamers, and we just want to do the best we can.
Yeah, that's I think that's a great great analysis, and some stuff I did not know. And also congratulations on the organization being able to get through 400,000 patients.
Thank you.
Certainly a impressive milestone, and I think that I think the orthopedic community has great respect for you, Dr. Zirkle, and really love to thank you for coming on the show. Hopefully, this will reach a lot of listeners out there. And so again, thank you very much. Best of luck. I do want to tell our listeners you can find out more directly from Sign Fracture Care by going to signfracturecare.org on the internet, and you can certainly support them directly there and learn more about the program. Thank you, Dr. Zirkle.
Thank you for asking, Dr. Raymond.